Hi guys, welcome back to the Mama Nurse channel. I'm Vanessa and today we're going to talk about working during a pandemic as a nurse and while pregnant. Don't forget to subscribe to the Mama Nurse channel where you'll find all things nursing and all things motherhood. So during the quarantine lockdown period, my unit, it's about a 36 bed unit and we had about 5 to 8 patients. The reason why our census was so low was because we are a trauma unit. In order to have traumas, people have to be out and about in motor vehicle accidents, motorcycle accidents, and things like that. So because of the type of unit that I work on, our census dropped significantly, which caused us as the staff to be canceled, floated, or pushed back. During this period, there was no overtime allowed. You were mandated to take your 30-minute break. You weren't allowed to skip it. If at any moment you thought that you wouldn't be able to take your 30-minute break during your shift, you were required to go to your charge nurse so that they could relieve you and you could have your break. There were no visitors allowed in our facility. There were 3 circumstances. The patient was actively dying, a mother was giving birth, or the patient was a minor and they needed that parental supervision. So when the lockdown period started, we had just finished a very large event in our city that typically brings in a lot of traumas, which it did this year as well. So right after that is when we kind of had this slower paced unit. So it was, in a sense, a relief, but it unfortunate circumstances. I was pregnant during this time, so I was not allowed to have any or any patients who were suspected of being positive. This was kind of a scary and different pregnancy for me. As you guys know, I've been pregnant pretty much the last 5 years. So for this pregnancy, I stayed home a lot just so that I wasn't exposed to anybody who could be positive. My spouse, really took in a lot of the outdoor duties in order to keep myself and our baby safe. So pretty much my life consisted of going to doctor's appointments and going to work and coming home. You would think that being a nurse, you would be more exposed, but thankfully the unit that I work on, we did not experience a high influx of positive patients because of the type of unit that we are on. They did eventually end up opening 2 separate units for those patients. One they opened up during the quarantine, and the second they opened up after the lockdown period was over. So prior to entering the hospital, or right when you got into the hospital, you were required to do a temperature check and you had to log this into the system before the start of each one of your shifts. It was also required to wipe down your surfaces and your station at least once during your shift, more so at my PRN job. But I always wipe down my surfaces before I even started my shifts. I'm a germaphobe, so I need to be in a clean environment, as clean as it can be in a healthcare facility. So I've always wiped down my computers, my phones, and everything that I will use throughout my shift. Special guest here. So after the quarantine period was over, they opened up, like I said, that second unit for the positive patients. In order to staff these units, a lot of our nurses and our techs were getting floated down to those units in order to help out. Even though not all of the patients were quote-unquote ICU type patients, they needed the expertise of ICU type of nurses to be down there. So typically 2 to 3 of our nurses were getting floated each shift. And that kind of limited the staff that we had on our unit. So either we were getting tripled or they were bringing in a lot of resource nurses to help out. So that at this time, overtime became more prevalent and you were able to get some extra shifts if you needed it. We still did not allow any visitors. We were required to wear masks in any patient care areas, or if you were around anybody, social distancing was not possible. One of our nurses actually flew to New York for a 28-day work experience. It's called crisis pay. So she went over there with a travel company and they worked basically for 21 days straight, and then she flew back home. If you were symptomatic in this time period, you did have to quarantine for 14 days before you could come back to work, and you also had to have 2 negative tests in order to report back to work. If there was any suspicion of somebody being positive, they were in isolation until it was determined otherwise. At my PRN job, any codes that we had, we treated them as if the patient was positive, meaning you had to wear your face shield, you had to wear N95, the full isolation getup, and they limited the amount of staff that were in the rooms during the codes. So the minimum amount of supplies and the minimum amount of staff. This was a very crazy time to, one, be a nurse, and two, being pregnant during this period. I always said that if I was not pregnant, I would have loved to be able to travel and help out those facilities that really needed the help and assistance during those peak times. But because I was pregnant, I was not willing to put my child at risk or myself to go do that. So working just as a nurse on my regular unit, seeing everything that was going on, and being pregnant, not really being able to go anywhere, it was probably a good 6 months that I didn't go to a grocery store or anything like that. Definitely different. You know, I've always been active during my pregnancies, and this one I wasn't as active because I was scared to go outside and exposed to anything. So I'm glad that the period is pretty much over, or at least subsiding for right now, and I hope it doesn't come back. But to all of those who are out there working hard, thank you for all that you do. So yeah, that's about it. I just wanted to give a quick rundown on my experience of working during a pandemic as a nurse and while being pregnant. I hope you guys enjoyed it. Until next time, stay safe, be well, and live life.